Assalamu alaikum. I am Dr. Rowshon Ara Begum, Assistant Professor, Department of Forensic Medicine and Toxicology, Bashundhara Ad-din Medical College. Today, our topic of discussion is pregnancy, a very important topic in term 2 examination. Now, the definition of pregnancy. In pregnancy, we may be defined as it is a physiological state of a woman in which the ovum is fertilized by spermatozoa and implantation occur in the wall of the uterus, subsequently grown to a full-term fetus. Also, we may say that a condition in which developing embryo or fetus in the female when ovum is fertilized by spermatozoa. So, the whole concept of pregnancy is about a female getting pregnant and leading into a full-term fetus. Now, the duration of pregnancy, normally we say that 280 days, that a week less or more, or by saying that 9 calendar months plus minus 7 days, that is calculated from the last menstrual period, that is LMP, and this is termed as expected date of delivery EDD. This duration is maximum up to 349 days and minimum up to 210 days, but least may be 180 days. The viable age of the fetus, a very important point in this aspect, as the age of the fetus in which it can survive under an ordinary circumstances out of the female uterus. It is 210 days in average, but the shortest period may be, as mentioned before, 180 days. This child can survive without the neonatal ICU support, and the child born after 180 days of uterine life may also be viable and capable of continuation of an independent life from their mother. So, the medical legal importance in case of viable age is first point infanticide, as well as whether a stillborn or a live born. If stillborn, death of the fetus is after the age of viability or before the age of viability is the stillborn, and also mother with a stillborn may charge for infanticide. So, the concept of pregnancy is very much important in forensic aspect because there are some medical legal issues. These medical legal issues is discussed in two broad spectrum, that is criminal cases and civil cases. In case of criminal cases, the first point would be the execution of death sentence, then exemption from the trial in the court. Also, pregnancy may be result from a result of rape, kidnapping or seduction. An unmarried girl of 16 years or less or a married girl of 15 years or less may be point out pregnancy due to commission of rape as an offense. A woman can blackmail a man for being pregnant by him, that may be fetched. A pregnant unmarried woman may bring charge of criminal breach of trust against a man who allegedly had intimate relationship with her that results pregnancy, that means the breach of promise of the marriage. Number 7 point will be that illegal pregnancy may predispose to suicide as well as may cause homicide also. In unmarried woman and even a widow, a question may arise for this pregnancy whether this intimately related with infanticide, criminal abortion as well as the concealment of the birth. Also, further pregnancy may be claimed after adultery. So, under section 416 of Criminal Penal Code, the High Court is the only judicial court which can postpone the execution of a death sentence confirmed by it, or even commute if the life imprisonment after it is satisfied from the medical practitioner's certificate that the woman is pregnant. Now, related to civil cases, first point is nullity of marriage. If at the time of marriage the woman is pregnant by another person, the marriage will be null and void. The decree of divorce may be granted from the husband's side if the pregnancy does not match with the duration of husband is said to be. Inheritance of property is very much important in case of pregnancy for the future, as well as in divorce situation a woman may allow higher compensation if she is pregnant. In case of the death of husband, the compensation cases from the authorized legal option is higher. Pregnancy beyond the scope of unlawful wedlock may make the future baby illegitimate. when a widow or an unmarried girl or even a married woman living separately from her husband can be defamed and be liable for this pregnancy. Working pregnant women are allowed additional leave faculties and facilities. And finally, it is possible that surgeon may terminate a pregnancy by carrying out a surgery which is termed as criminal abortion, and for this the practitioner may be convicted of professional infamous conduct and may have the professional death sentence. So, in this whole concept there are certain types of pregnancy. First of all, it is said whether it is a true pregnancy or false pregnancy. If it is true pregnancy, there may be either uterine pregnancy or extrauterine pregnancy. Our main concern is for this uterine pregnancy. Also, false pregnancy are present with the same symptom of this pregnancy same to same, as also termed as phantom pregnancy, spurious pregnancy, finged pregnancy or pseudocyesis. Now, the pregnancy is diagnosed in case of living and in case of death. We may answer the questions whether it is living or dead pregnancy. In case of living, the pregnancy is diagnosed further for medico-legal purposes, whether ordinarily it is difficult to establish whether it is pregnancy proved or not. By history, examination, examining the sign, symptom and history, and further lab investigation. So, by the examination there are three certain stages and symptoms, that is presumptive sign, probable sign and finally positive, that is also termed as conclusive sign. First of all, presumptive sign, we may say that cessation of menstruation, that is amenorrhea, due to other causes may also for this. Also morning sickness, vomiting which may be excessively turned into hyperemesis gravidarum. Quickening, that is the feeling of life at the period of 16th to 20th week, that is the first perception of movement of the fetus felt by the mother. Changes in the breast is common in that cases. Also some sympathetic disturbance like salivation, desiration of spicy food or even abnormal food appetite, irritable temper, etc. Some pigmentation of the selective parts of the skin as mentioned, eyelid, axilla, vulva and areola of the breast, appearance of linea nigra, stria gravidarum, Jacquemus sign, increased frequency of micturition and easy fatigability, irritable temperament. Then the probable signs. First probable sign we may assume that is the enlargement of the abdomen, which is measured the height of the uterus. In case of 12 weeks, it will be at the level of the symphysis pubis, at 16 week between the symphysis pubis in umbilicus, 20th week we say it is near about the umbilicus, 24th week above the umbilicus, and finally we can say the 36 or 37 weeks that reaches the xiphoid process and further much, then it converts downward. Haggard sign, atroversion of the uterus, Goodell sign, Paxton-Hicks sign, uterine shuffle and ballotment. These are all the symptoms of probables. And also some biological test and immunological test is done. The first biological test we done in early pregnancy is human chorionic gonadotropin in the urine or in the blood. Also immunological test involving the ELISA and also RIA. Now the most important cases, the positive signs which are questioned in the written as well as the viva, that is what are the positive sign or conclusive sign of a pregnancy. The palpation of the fetal parts after 24 weeks of gestation is felt. Perception of fetal movement which is possible from 16 to 18 weeks and may be seen at 5th month. Auscultation of the fetal heart sound, it is between 18 to 20 weeks. At early pregnancy, it is 160 beats per minute, at mid pregnancy 140 beats per minute and finally at late pregnancy 120 beats per minute. Also some phonic or umbilical shuffle, placental shuffle, and most probable is sonography, that is the positive sign at 6th week by, and TVS it is 5th week. That's all for today. Thank you. Assalamu alaikum.